Hello, my name is Deshay Taylor, and how are you today? As you may know, I'm here from the Harding organization today to discuss Brody Carter. Brody is 15 years old, sophomore in high school, one of our recent clients. His mom was concerned due to his above and beyond teenage disobedience. She explains that he's always had a form of disobedience, but she just assumed it was normal. When he was younger, she would tell him not to do something because it was dangerous and he would do it anyway. Since taking him on as a client, Dr. Harding has diagnosed Brody with oppositional defiant disorder, also known as ODD. ODD, as you may know, is a behavioral disorder that can cause an individual to lose their temper, become argumentative, have a lack of compliance, deliberately aggravating others, vindictive, and even spiteful. After explaining this diagnosis to his mother, she revealed that Dr. Harding, that Brody's father, was also diagnosed with this in high school, but she would have never thought her son could have it. It was then explained to her that ODD can have a genetic component and is more prevalent in boys than girls. Mrs. Carter then explained to us that he has no drug history or problems legally yet. His argumentative nature when something was asked of him in school, along with his annoyance and picking fights with teachers and school staff, is just one piece that supports his diagnosis. She is mostly worried that his behavior will escalate and cause more trouble with his academics. However, we know his behavior can escalate at home and have explained this to her. We explained how important this diagnosis and treatment plan is for him. His argumentative nature has been intentional, his lack of compliance is dominant. His intellectual abilities are somewhat above average, but he is refusing to do his schoolwork, and this has caused his grades to slip. There has also been issues in the past, and even now, where he constantly aggravates others around him, where he has been asked why. He said, "Because I want to." He has been vindictive by showing aggression towards his teachers for letting his mom know about his behavior. Brody shows clear signs of ODD versus a diagnosis of attention deficit hyperactive disorder, also known as ADHD, because it's intentional rather than lack of processing. Although this diagnosis can be comorbid, we need further evaluation before we are able to say for sure. Since his diagnosis, we have seen some progress through his individual therapy based on cognitive behavioral therapy. This therapy can help using problem-solving skills and perspective taking to alleviate aggressive behaviors. Brody still struggles, but is now following directions on assignments and somewhat completing them. He still finds himself arguing with teachers and deliberately aggravating others. Dr. Harding is potentially looking at a mood stabilizer in the future if he ends up needing pharmaceutical help. We have high hopes his therapy will work out for him, and he seems to enjoy it. Our job is to make sure he is advocated for and gets the help that he needs.